green if you're not muted. So just so that you become familiar with GoToWebinar, and hopefully it's easy throughout the process for you. All right, so without further ado, let's introduce our first set of speakers. I would like to give a big warm welcome to Jesus Manzo, Yoreli Ortiz, and Ken Almanza.
Hey everyone.
Get over.
Okay, well, thank you so much, Elise, for that warm welcome. So I want to start off with our PowerPoint today about Public Health 101, Seeing the Big Picture. So thank you everyone for joining us, for taking the time to listen to what we have to say. So today's information is designed for youth and adolescents and those who provide services to this group. If you could please go to the next slide, Elise, I would appreciate it. So we're going to start off with talking about public health, what that means. So according to the CDC, public health is the science of protecting and improving the health of people and in their communities. So what exactly does that mean? How do people in this field do that? So improving health is achieved by promoting healthy lifestyles, researching disease and injury prevention, detecting, preventing, and also responding to those diseases. Professions in this field, they work to limit health disparities. And what that means is they're just trying to have equity, quality, and accessibility of healthcare for all. And the populations that they serve can be as small as a local neighborhood or as big as an entire country or region of the world. So these professionals, they try to prevent problems from happening or reoccurring again, and they do this by implementing educational programs, they recommend policies, they administer services, and they conduct research with what is going on in the world. And what is Reach Out's public health role in the Inland Empire? So us as a nonprofit agency, we have many different events, programs that go on. So we have our conference that we do every year where we bring the leaders in public health together in this region and we talk about all our goals and what's going on. We also have the IHPC team that I'm sure you're aware of. We have a Latino Health Collaborative that helps with specific programs going on in the region. We do classes for parents, and we also have healthy city coalitions to make sure that we're targeting cities and make sure that they have a healthy city to live in. If you could please move to the next slide, Elise. So there are many career paths connected to public health. As you can see in this image, it really shows how public health is tied into a lot of local and community resources and how they intertwine. So Reach Out specifically, me and my team as outreach specialists, we partner with different agencies and with different facilities, and we target the community, and we focus on community engagement, on passing policies, educating our future leaders, and as well as leaders in the community that could be adults and teens. And we also focus on prevention education. So what is prevention education? So that is when we target individuals to teach them the physical, social, and psychological consequences of drugs and alcohol. And we really try to change their behaviors. And in order to do that, we work with different nonprofits. We work with different treatment facilities, with faith institutions, elected officials, and so on. We also have the IHPC team who is connecting youth within the empire to healthcare opportunities. So that could either be by job shadowing and gaining different experiences within these agencies within the Inland Empire. So I hope this really ties in together and shows you how the community as a whole is connected through public health. Later on, as mentioned, there's going to be a public speaker who will talk to you about these specific career paths that you can take. But we're going to move on to the next slide. So public health, we want to connect it to one of our grants that we're focusing on right now, which is MAT, Medication Assisted Treatment. And this presentation is actually funded through one of their grants, the MAT Access project, and that's funded through the California Department of Health Care Services, and it's being administered by the center at the Sierra Health Foundation. So pretty much this program aims at targeting opioid use disorder and substance use disorder and reducing the stigma and also showing the effects of these disorders. Now more than ever is important to discuss substance use disorders because as we see in what's going on with the world, many people are facing hardships. Their everyday lives have changed. So people, both young and old, they're turning to substances like drugs and alcohol to help cope with the anxiety and with the stress. That's how they're trying to deal. But it's important to talk about the harmful effects, the consequences of doing that, and also educating ourselves about the resources that are out there and how to help our family and friends. So we're going to talk about that a little bit more, and I'm going to turn it over to my colleague Jesus, and he'll be giving you a little bit more detailed explanation of what MAT is. Take it away, Jesus.
Okay, so we can go to the next slide. Okay, so before we begin going in depth on our substance use presentation and our opioid presentation, Elise, could you please start the poll? So we're going to take a quick poll here that'll really help us gauge our audience so we can better suit the presentation towards the audience.
Of course, Jesus. So for your first poll, it is about to launch right now. So if you can, please take a moment to answer this question. Okay, that's about everyone. I'll close that one out. And Jesus, are you okay if I do the next few?
Yes, please.
Okay. Here's another poll for you launching right about now. Okay. We'll close that one out. We have just a couple more for you. This is a really great way for our speakers now to gauge the audience and see who we have here with us today. Looks like we have a lot of attendees who are aged 13 to 17. Give it a couple more seconds for you to answer. Okay, we'll close that one. Thank you. And two more for you. Here's this next one. You should be seeing that now. Perfect. That was rather quick. Okay, I'll close this one. And last but not least, this is the last poll you'll be seeing in this section. I'm only limited to 5 answer choices for some of these questions, so just so you know, we wanted to put more on there, but thank you for your understanding and for answering the question. We have about 82% voted. Okay, perfect. All right.
Okay, thank you, Elise, for handling all the polling. It's good to know that we have a lot of young people out there interested in public health. So now that we're getting more into the presentation, here's just a quick roadmap of what we'll be going over. So we'll be explaining the human brain, substance use disorder, substance use among youth in California specifically, and then we'll be going a little bit more in depth on a specific drug known as opioids, and then the different types of treatments that we can get for substance use and opioids. And then we'll cap it all off by showing you some resources and how you can seek help if you need it. Okay, so if we can go to the next slide, Elise. Okay, so I know we're not in a classroom, but typically if we were in a classroom and I asked everyone to raise their hand if they partook in any of these activities pictured on the screen, I'm sure we would have a lot of hands up in the air. So whether it be using your smartphone or learning the newest dance on TikTok or getting a win in the battle royale, or just even going out to eat with your friends or your family, getting your favorite late night snack. So just a question for the audience, if anyone's willing to answer. What do you think all of these things that are pictured up here, all of these activities have in common? So if you want to answer, you can just go ahead and unmute yourself and let us know your thoughts. Okay, no takers? Okay. So basically, some of the things that these all have in common is that these behaviors send signals to your brain that usually produce a good and pleasurable feeling. So for example, if you are playing Fortnite and you win the battle royale, you'll get a pleasurable feeling in your brain that'll make you want to continue playing. Or if you go to Jack in a Box that's pictured here and you get some crunchy tacos, those that you really enjoy, once you start eating them, even when you smell them, your brain will be triggered, and it'll start feeling good and pleasurable to you. So if we can go to the next slide, Elise. So why does that happen exactly? Well, there's a system within the human brain that's known as the limbic system, or it's also more commonly known as the reward center of the brain. And every time you partake in any of these activities, your brain produces a chemical called this dopamine, which is known as the quote unquote feel good chemical of the brain. So whenever your Instagram notification goes off, you get likes on your newest upload, or you take a bite of your favorite food, your brain is going to produce the dopamine, which is going to tell your brain that this activity, this food, this thing that you're doing feels good. This feels like a reward. So if you imagine whenever you give a dog a treat, you can see how happy they get and how elated they are. So it's basically the same type of reaction within our brains, where when we partake in these activities and dopamine gets released, our brain tells us that that's a good thing and we want more of that. So typically when our dopamine levels in our brain are balanced, um, it, it, it becomes very important to have these levels balanced, because it gives us the motivation to actually do things within our normal day-to-day life. Something as simple as being able to get up in the morning requires a balanced level of dopamine. So things like exercising, playing sports, socializing, all of these activities produce different levels of dopamine in the brain. And if you can see on this image on the screen, typically the normal range of dopamine in the brain should be between 40 to 100 nanograms per deciliter. So just keep in mind that range when we start to talk about the effects that drugs have on the brain and on these levels. So when you're on the lower end of that spectrum, so closer to 40 nanograms, that would be like maybe like a sick day where you just don't feel that motivation, that energy to really do anything. All you want to do is maybe just lay in bed. And then closer to the top of that range, so 100 nanograms per deciliter, That's more of when you're having a great day. Your self-esteem is up. You're really feeling good, and maybe you just got an A on that math test, so your mood is really boosted. So you would be closer to that 100 nanograms per deciliter mark. However, when you have too much dopamine from using substances, this can overload your brain and throw your natural balance off sync. So at least if we can go to the next slide. So as we can see here, um, different drugs have different effects on the amount of dopamine that's released in the brain. So if we can see on the left-hand side, things like heroin and methamphetamine, those have a bigger bubble, meaning that they impact the production of dopamine in the brain a lot more. But things like alcohol and marijuana also have um, a big impact on how much dopamine levels are released in the brain. So for example, marijuana and alcohol can push dopamine levels into the high 100s. Remember that normal range is 40 to 100 nanograms. So alcohol and marijuana will push it past the normal range. But then we have what can be considered harder substances, harder drugs to take, like heroin and methamphetamine, which would be ultimately pushing dopamine levels in the brain 10 times their normal range, so into the 1000s nanograms per deciliter. So our brains are wired in a way that they're not meant to function properly under those extremely high levels, which makes it really dangerous when people are seeking that instant pleasure that substances can bring. So when someone takes a substance, it instantly elevates the dopamine levels in the brain, but it's only for a short time. And once that fades, the person is left craving for that experience again. So they'll be constantly on the lookout for repeated use of substances in order to boost their dopamine levels way past their normal levels once again. And repeated behavior and substance use can eventually lead to the medical condition known as substance use disorder, which we'll talk a little bit more about in the next slide. Okay, so what exactly does substance use disorder look like? Well, we found this image that really lays it out. If I hope you can read what the little tags say, but basically, this is some of the criteria that's used by professionals to define substance use disorder. Some of them being like cravings for the substance, wanting to cut down on the substance and not managing to, because those cravings are so intense that they're always seeking the substance out, and they're always wanting to get more and more of the substance. Taking the substance in large quantities or for longer than they're meant to. So let's say for prescription drugs like opioids, which we'll talk about a little bit later on, those are prescribed and they have a specific dosage and amount that's supposed to be taken. So if somebody's taking a lot more, or they're taking it for longer than they're supposed to, this can be a sign of a substance use problem or disorder. And then also neglecting work, neglecting your social life, neglecting your daily responsibilities. So one of the key things to know is that when we're dealing with substance use disorder, it really comes down to how it impacts the person's daily day-to-day living. So if the person can't go on about their normal day-to-day life and day-to-day activities because they're always seeking and they're always in need of substances, and without it they can't function normally, then that would be cause for seeking treatment for substance use disorder. And it's also important to note that when you think of substance use disorder, unfortunately, currently in the environment that we live in, there's this stigma around people who are suffering from substance use disorder, whereas people seem to treat or tend to treat them as if they're morally wrong or bad, and they say things like they did this to themselves, they're only taking these drugs because they want to, when in reality it's something a person can't control. The repeated exposure to substances, whether it be prescription or not, changes their brain. As we mentioned in the previous slides, there's a chemical reaction that happens when someone takes a drug. So that's physically affecting their brain and changing their brain, so to the point that they can't really control whether they have this disorder or not. So let's think of an illness like diabetes, whereby um, whereby it's a medical condition that requires treatment in order for the person to maintain their normal life. So the same way we view diabetes, which we don't blame the person for having diabetes, we don't stigmatize them. The same way we should be treating substance use disorder and not blaming the individual, and really aiming to help them with the medication and the treatment that we'll talk about a little bit more later on in the presentation. So it's really important to understand that everyone is coming from a different upbringing and a different family situation. So we don't know what got the person to where they are right now, but we really need to start pushing to have more help out there for them. So if we can go to the next slide, Elise. So this is an open-ended question that I just wanted to give to everyone, if you're willing to unmute yourself and share some of your thoughts. So what are some substances that students and peers like yourself might be using? Was that somebody?
Okay, Jesus. Keep going.
Okay. So what are just some substances that you've heard or that you've personally seen some of your peers using? Once again, if you want to share, you can go ahead and unmute yourself, and we're in open space. We can discuss anything you would like.
So to do this as well, I'm noticing on my end as a facilitator, if anyone would like to ask a question or to join in on this conversation, I highly recommend it. I will unmute all participants at this moment. I think there may be a little glitch, but I'm going to unmute everyone.
Rancho is that they have been doing classes.
Let's see here. Or if you'd like, you can raise your hand. I believe that function is available. No takers?
And if you don't want to unmute yourself and speak, you can also use the chat function and just let us know your thoughts, and we can read them out and discuss them.
Thank you, Jesus. I'll let you know if we have any questions in the chat.
Okay. So basically, something that we've noticed through our work and through researching the different substances and substance use disorders, we've seen that in California, many high school students tried substances to get high as they moved from 7th through 11th grade. And the reasons for that vary per an individual basis. It can be curiosity, peer pressure to fit in, or maybe there's stress or trauma in the household, or maybe there's just a lot of pain in the household. But when we're talking about, for example, opioids, what we've learned while researching up on this topic is that oftentimes when young people come into contact with opioids and they start taking opioids, it usually comes from within the household itself, whether that be opioids that were prescribed to parents that were left in the medicine cabinet, and the youth just found upon them and started taking them, or whether it be they were given to them by friends or family members. We have seen a trend where young people taking opioids usually starts within their own household, and it is an alarming statistic that we're working more and more on to bring some more light onto that issue. So if we can go to the next slide, Elise.
Of course, and we actually did have a response to this question that's up on the slide. We had one student, Lauren Perez, who answered with marijuana.
Marijuana, that's definitely one that's a lot more commonly seen in schools, in pop culture, in the media. So that is one of the biggest ones that we're seeing young people using, especially now that it's become maybe a little bit more accessible with things like vaping pens, and all these different types of like edibles. And it becomes easier to acquire and becomes easier to maybe hide from authority figures and parents. So that's definitely one that we're seeing a little bit, keeping a closer eye on.
And thank you for your participation, Lauren.
Okay, so I know I gave you a lot of information so far. So I just wanted to give a quick review time. So it's just a quick poll to see how you're picking up the information, or if you need me to review some of the material over again. So Elise, if you can just launch the next two polls.
Of course. Okay, everyone, you should be seeing this next poll right now. Give it a couple more seconds. Okay. So, Jesus, would you like me to share these results?
Yes, please.
Okay. So as you
Okay.
can see, we had 14% who selected GABA and 86% who selected dopamine.
So dopamine is the correct answer. So GABA is actually another chemical within the brain that doesn't necessarily have to do with feeling good or not. So dopamine is the correct answer. As I mentioned earlier, that's the feel-good chemical that gets released whenever we do anything pleasurable. So good job to those who got the correct answer, and good job to those who tried.
Okay, and now for our next poll. Okay, pretty quick response. I'll go ahead and share those results as well.
All right, so the correct answer was false. So the key thing when you're thinking about substance use disorder is to really see whether the individual is being impacted on their day-to-day life. So for example, if they can't go about their regular routines as they would normally, because they're too busy craving a drug, or they're too busy seeking out the drug, or they need the drug in order to function, that's when you would maybe consider it a substance use disorder. So just the simple act of taking a drug in and of itself doesn't qualify for a substance use disorder. Um, Drugs are used all the time for different things. There can be medical procedures, there can be cultural elements to taking drugs. So whenever you take a drug, it doesn't automatically mean that you suffer from a substance use disorder. So it really does come down to that day-to-day activity and how that impacts your day-to-day life. So if we can go to the next slide. Okay, so now we're going to start going a little bit more in depth into opioids, which is one of the key components of the MAP project that my coworker Yareli mentioned in her section of the presentation. So opioids specifically, you may have heard of the drug, maybe not by the term opioids, but by their more common names. So opioids are known as painkillers or pain relievers that are prescribed medications by doctors. So there are a lot of different pain relievers and painkillers that you can get over the counter. Those aren't considered opioids. So opioids are really powerful painkillers that are by prescription only. So you can only get them if your doctor gives you a recipe for them. So they're often prescribed after major surgery to block pain. So for example, let's say somebody gets their appendix removed. they can get opioids prescribed to them if they're in intense pain, or sometimes people get them prescribed if they're having pains because of their cancer treatments or because of their cancer diagnosis. So this is not to be confused with the over-the-counter things like aspirin or ibuprofen. These are more like what would be recognized as Oxycontin. Um, and then opioids are some of the strongest pain blockers, and they're only intended for a short-term use under strict care by medical providers. So if someone gets prescribed opioids, they get prescribed directions specifically on how they should take it and for how long. Anything over that can cause um, a lot of damage to the person's system. So it's really important that if you ever get prescribed opioids, or if you know anyone who gets prescribed opioids, that they follow the instructions of the medical provider to the strictest possible method they can. Because overall, opioids are highly addictive, and misuse can lead to physical dependence, which means that they'll be depending on taking the drug, and then physical dependence can then lead to a substance use disorder, and it can happen very rapidly. So it's really important to have that conversation with your doctor if you ever are in the position where they want to prescribe you opioids. And one of the most troubling trends that we've seen specifically for teens is the mixing of opioids and other substances like alcohol, which has shown to lead to overdose and death. So it's one of the trends that the the people who work with opioids in the medical field are keeping an eye on. And opioids and opioid overdoses have become such a big issue across the nation, that in 2017, what's called the opioid epidemic was declared a public health emergency. So currently there's a lot of different programs and a lot of government money that's being funneled into work like we're doing here at Reach Out, into looking into opioids and trying to curb the increasing rate of overdose deaths used to opioids. So if we can go to the next slide, Elise. So just I guess, do you recognize any of these people on the screen? If we were in a classroom and I asked this, I'm sure a majority of you would put your hands up and recognize some of these people. So these are all of these pictures, images up here are of public figures and celebrities who have we've all lost due to opioid misuse and overdose. So the opioid problem affects all ways of life. So as we can see up here, it doesn't really matter your age, your race, your gender, your cultural background. All these people come from different situations, and they were living vastly different lives. But unfortunately, we all lost them to opioid misuse and opioid overdose. So people like Mac Miller, Lil Peep, Juice WRLD, Heath Ledger, Whitney Houston. So all you have to do is Google celebrities or famous people who have died of opioid overdose, and you'll get an extensive list of people who have died because of this drug and the misuse of it. So these are only a small part of over 500,000 Americans who have died from the drug between the years of 2000 to 2015. So the rate of overdose deaths has been since the 2000s has been increasing exponentially. So it's really important that we look into what's causing this, what are the root causes behind these deaths, and really start to have that public health lens put over the drug, and really start to see what we can do as organizers to really make sure that the rates of overdose deaths starts to decrease. Okay, Elise, if we can go to the next one. Okay, so like I mentioned, anyone really can be prescribed opioids from a medical professional. However, people can also get it from illegal sources. So what I put up here on the screen is the cycle of opioid use. So the drug comes from either a medical professional or illegally. Most commonly, it comes from a medical professional, and it comes in the form of the common legal prescriptions are Oxycontin, which is commonly known as Oxy, Percocet, or codeine. And then when the person takes that drug, they get they get that boost in dopamine, so they feel really good. Like if you imagine a roller coaster, you take the drug and you start going up and up and up, and then eventually all that up has to come down. So you get mood changes, weak bones, nausea, headaches, shivers. So you go back to your medical provider to try and get more drugs, and maybe they'll oblige you the first time. So you go through the cycle again, where you get it from your medical provider, you take it, you go up in your mood and you're feeling good, and then you come crashing down, and then you try to go back to your medical provider again, but this time they cut you off. They say we can't give you any more opioids. So they cut you off, and what we've seen is most often people get cut off and they don't get redirected to services to help them cope with that dependence that they've built to the opioids. So people are left to try and find that same high. And that's when they go to illegal methods. So they get illegal forms of the opioids, so like heroin, and then that they begin with that cycle again. This time only it goes illegal and then heroin, and then they go up and down, and then they keep going back to the legal routes of um, of getting that drug. So it is a cycle that needs to be looked at and needs to get broken. We really need to start pushing our medical providers to reroute patients that they're taking off of opioids to services that can really help them get better and not have them physically dependent on these drugs. And that's something that we'll go into a little bit in the next slide on how that can be done. Okay, so before we get to that, we have another review time. So let's go ahead and launch those polls and see how we're doing on the information.
Of course. Okay, everyone. Here's a little pop quiz coming at you right about now. Looks like we have about 50% voted. I'll give it a couple more seconds. Okay, and Jesus, I'll go ahead and share those results for you.
Okay. Okay, so the correct answer was painkiller prescription only. As I mentioned before, opioids are specifically painkillers that are prescribed by doctors. So painkillers that are over the counter, like aspirin and ibuprofen, those are painkillers, but they're not opioids. So what distinguishes them is basically the strength of the painkiller and also what it was made from. So opioids are typically made from the opium poppy, which is a plant, and other painkillers are made from different materials, and then antidepressants are a completely different type of drug that isn't connected to opioids.
Okay, and then one more poll. Should be seeing that right about now. Okay. And here's those results.
Okay, so all of the above was correct. So whoever chose headaches, you're partially correct. So if we go back to if you think back to the image of the cycle that I showed you, towards the end of that cycle, when you come back down from that high, and you're taken off the meds without proper medical assistance, you do have issues with mood changes, weak bones, nausea, headaches, shivers, which are also known as withdrawal symptoms. And that's really one of the hardest things for somebody trying to get off drugs. To that period of withdrawal is one of the hardest phases to get past, which is oftentimes why people relapse and they end up back on the drug, is because all of those mood changes, weak bones, nausea, headaches, all those withdrawal symptoms are very rough on the body, and it's a lot easier to get back on the drug than to have to go through the withdrawal phase in order to get more help. Okay, so when we talk about getting help, one of the most important aspects is what we know as the medication assisted treatment, which is what MAT stands for, which is the name of the project that me and my colleagues have been working on for the past several months. So when it comes to this treatment, it functions off a combination of medication and therapy. So if you look on your screen on the left-hand side, you'll see the medications listed out. The names aren't really that important at the moment. Just at the bottom, you'll see what it does to the person who takes this medication. So basically, by taking this medication, you're normalizing the brain chemistry and body functions. So when someone takes this medication, they're basically normalizing the levels of dopamine in the brain to a state where they can focus on their therapy. So they're not always constantly having to deal with the cravings and having to deal with the nausea and the headaches because the brain chemistry has been normalized by the medications. And then they also block any sort of euphoric effects from opioid highs. So if someone's on this medication and they end up taking an opioid, most often that opioid won't have any effects on them because the medications are in their system and they're blocking the brain from accepting that drug. So when all of this gets taken into account, then people have a lot better chances of seeking out therapy and really focusing on their therapy. So that's why medication assisted treatment is a combination of medications and therapy in order to have like a whole person approach whereby the person is taking the medications to stop the cravings, and then they're getting their therapy in order to teach them how to cope better with any sort of struggle that they may be going to, and finding proper coping skills so they don't have to rely on going to drugs to sort of numb their pain or their issues. So that's the biggest sort of medical support that we're trying to push medical providers to give to their patients who are on opioids. So whenever someone is given an opioid and then they're taken off the opioid, we would hope that they then get, if needed, get introduced to the medication assisted treatment so that they can stop that cycle of opioid use that we talked about earlier. But other ways of getting help that that we can offer is through our Choose MAT website. So if you look at that middle column, if you or anyone you know is seeking treatment for opioid use disorder or substance use disorder, they can go on this website, choosemat.org.org, and they can find a treatment locator there where you just simply put in your zip code, and it'll tell you where the locations are where you can get help or you can send anybody for help. And then at the very bottom, there's also the Samson National Helpline, which will connect you to a referral systems that can help find the best treatment options for the person. And then another way that we're pushing to help sort of alleviate this epidemic is by having local efforts. So basically what Reach Out has been doing is we've been putting, if you see on the right side of your screen, we've been putting medication drop-off boxes, which basically are safe ways to deposit or get rid of medications. So let's say someone in your household gets prescribed opioids and they go through their treatment, and they still have some left over. Instead of keeping them in the household where they might fall into the hands of the young people in the household, they can take them to these medication boxes and just drop them in, and they'll get thrown away appropriately. So we have a lot of these boxes across the San Bernardino and Riverside County area, but there's also different counties that have their own local boxes. So you can always just search them up by Googling medication drop-off boxes near me, and it'll give you a layout of where you can do that. Elise, if we can go to the next slide. Okay. So Ken, I believe this is you.
Yes, Jesus. Oh my gosh, thank you for that. Did you have a post test you wanted to run, poll?
Yes. So Elise, if you can launch the last 4 polls.
Of course.
And while those are being launched, I just want to acknowledge that I did give you a lot of information right now. So if you have any questions, just go ahead and put them in the chat. Or if you want to reach out after the presentation, you can always email Elise and she'll get us the information and then we can get back to you.
Okay, I'll close that one. We got 100% yes. Now I'd like to launch another poll. Also 100% yes. Here's the next one for you. Okay, it looks like it was everyone's first time hearing this presentation. This is just to let us know how you hear about what we promote in different seminars, programs, opportunities to work with Reach Out. Okay. Thank you. I was pretty much split across all of them. And last but not least, or actually we'll stop there for now. So thank you so much, Jesus.
Yeah, thank you, Elise.
Awesome, awesome. So how's everyone doing out there? Welcome. So again, thank you guys for having me. Yareli, thank you so much for setting up that entire landscape. I love that bubble of seeing how, everything is connected, right? Public health has so many different arms to it. And Jesus really going over just that one specific arm, right? With substance use disorder, medication assisted treatment. So you're probably wondering why we've given you so much, we've overloaded you with all this information, right? And we've done that because we have the trust and the faith that you will use this information for the greater good to make that huge impact in the community. And this is how you do it. So how can young people address these public health concerns, not only by working in the field or seeking out careers in the field, but also as advocates, right? Advocacy may be something that you have learned already in school, or you may have advocate for things already in your life. It's something that a lot of us do as part of our civic engagement to better our communities. So just some simple ways to start here on this slide is really educating yourself. So participating in slides like this, presentations, any opportunity you have to educate yourself, and teaching that information back to your friends, to your family, and those on your social media, right? We're seeing a lot of that right now, people sharing information about various different topics on social media, right, to become aware. and learning about advocacy and joining youth advocacy programs. So if we can go to the next slide, at least, I will go over and explain what advocacy is for those who are not familiar. So what is it in the first place, and why is it important for youth, right? So advocacy definition, if you Google advocacy, this is what pops up. Public support for or recommendation of a particular cause or policy. So let's connect it with today's presentation, right? So you could say that Reach Out advocates for those experiencing substance use disorder and provides education, awareness, and directs community members to treatment across San Bernardino and Riverside County. However, when you take a really deep dive on each of the cities that everyone in this call lives in, there are very specific issues, right? Various public health concerns that exist that need to be addressed depending on where you're living, right? And you can see things as simple as, you know, when you see homeless encampments on the side of the freeway, or you see places where there are no sidewalks for you to ride your bike or skateboard. You can see the lack of grocery stores, you know, so simple things you can actually visually see in your city that needs some attending to and some concern. So youth advocacy, the way that youth advocacy in particular helps is it helps empower young people to understand all the ways that public health areas can affect them. So education, housing, employment, unemployment, your health, recreation, your human relationships. So again, this encompasses everything. And as a youth advocate, learning about advocacy gives you that insight into the adult world, right? So adulting 101 was last week's session, right? Understanding, you know, about the college process, that decision process. So another part of that is learning how to move in the world, right? As an adult now. So how to make decisions and how authority, you know, your local city officials, how council members, how that affects you, and understanding how the legal process works, how voting works, how policy works, right? So all of those things are tied into your community, your life, your family and friends' lives. It's all kind of encompassed together, right? So by learning about the principles of advocacy, it better informs you on how to address those things and how to make real actionable change. So if we can go to the next slide here. We can go back one. So the most exciting part is that you could take part in this advocacy immediately. So Reach Out has this exciting new program called Mobilized Youth for Action, the MYC program. So this is a new collaboration with IHCP, or IHPC, I'm sorry, to really collaborate forces. So the MAT team, so Jesus, myself, Yareli, to combine forces and to create a program that addresses the development of health policy and advocacy. In this program, we will identify a public health issue around substance use disorder and learn how to campaign around that issue. Jesus really did a good job about explaining about all the issues, specifically, you know, in Riverside, San Bernardino County, how we have a lot of resources because this is an issue that is in a lot of our cities, and how through advocacy, we can help identify what are those structures, who are the key leaders that are part of healthcare, part of delivering treatment, that are health outreach specialists like ourselves, what are the organizations, everyone who's kind of playing a part, right, in helping the community. And through this, helping you develop what's called a resolution. So bringing a resolution to your local leadership in your city, which basically means bringing forth something that you see as a youth advocate that you want to see change. And in this case, substance use disorder. So next slide, at least. So these are going to be the specifics about this program. So you probably didn't know, but you actually did session 1 already. You did the Public Health 101, you did the orientation. And for those who didn't make it today, they definitely have a part 2 to still participate. We have this session will be recorded. You can watch it at a later time. But what we're doing is we are starting as of next week. We're actually we wanted to rush this out. We know that a lot of students are at home, and we wanted to give a purpose to a lot of people who are at home to actually engage. So we have this incredible new opportunity that starts next Monday, going through Wednesday, so the 29th through the 1st. And just kind of an overview of what we'll be covering is listed here on the slide. All these sessions will be offered here on GoToWebinar at the same time from 1 to 2:30. So a part of this to incentivize people to participate is there is a stipend involved. So a stipend is just a compensation to basically be involved in these activities and to complete them and to join in. And for the youth who does complete 4 training sessions and they commit to the support and the outreach and promotion of this program will qualify, they can qualify to receive a $200 stipend, right? Who doesn't like a stipend right over the summer? A lot of you are transitioning, adulting, you know, that can come in handy. And additionally, we have past session 4. So we have like a session 5, 6, and 7. If you complete those and you actually complete a resolution, like I had mentioned, and you actually support that in bringing and passing that resolution with local government in your city, you also qualify for an additional $200 stipend. So after knowing that, I want you to launch that poll, Elise. I want to see who is interested. Who is interested in doing this? I know we threw a lot at you and we don't want to overwhelm you, but we definitely want to make use of your summertime. We want to make sure it benefits you. So if you could launch that poll, we just want to see a makeup of who would be interested. Yes, no, maybe, or maybe you just want more explanation. Go ahead and just let us know to give us an idea. I mean, at least you don't have to share the results. It's just internal for us to know how fast or how slow we need to move with this, but we definitely want to get everyone involved. If we could go to the next slide, at least. So you're ready to sign up? I know you learned a lot today, but what we did is we actually have a program called Cognito. So basically it's a registration process. So this is a formal program that requires formal registration because it does involve, you know, stipend, and it involves a certain set of attending sessions. So there is a link that I believe Elise will put in the chat box. It is also on this slide if you want to jot it down and visit it on your phone or laptop at home. You could also hyperlink it in the chat. And also, we are going to email this link, this registration link, to everyone who is in attendance today on the call. So that'll be in your email after this session is done. The deadline, everyone, the deadline to apply is this Friday. I know it's short, but we definitely wanted to make use of this collaboration with everyone and getting everyone's attention and going through the seminars and let you know that this is something you can definitely take part in. You can put it to use right away. You can start learning and not forget about what you learned here today. And I just want to reserve the rest of this time to allow you to unmute your mic, to ask any questions you have about this portion, the program or the presentation. You can also definitely send it in the chat box, but I just want to spend a little time for any questions anyone has. I know we have a small group today, but we definitely want to make sure we answer your questions.
And as well, too, if anyone does have questions, I believe our speakers will be hanging with us for a little while. So if there's questions at the end as well, we can always bring those up. And if you would prefer, I can write my email in the chat, so you can email me. But again, we'll be sending out an email at the end so that you have the link to register.
Yes. And just before we move on to our next speaker, I just want to again thank everyone for being attentive, for participating in the polls. This is a new program and the success is based off participation. So we want to thank you for participating. And if anything that you take away from today, just know that your input, your talents, your knowledge, and your passion, that's going to lead us into a better future, a better world for everyone, a better community for everyone. So hopefully I pray that our MAT team will get to see you next week and we'll get to work with you and see you on the program. So definitely click the link, email Elise, and you'll also be getting on your email, okay? So thank you, everyone.
All right. Thank you so much to Jesus, Ureli, and Ken for that wonderful presentation. I think we learned so much from that around the MAT project and substance use disorder as a public health concern. So I hope that you're interested in some public health policy and being a part of the Mobilized Youth for Action program, and you do sign up. This is a great way for you to build up your resume and build up your professionalism so that when you do go into the workforce, you have something that sort of sets you apart. And on top of that, there is an incentive. So, and that does not happen very often. So I hope you all feel excited and ready to learn from that program. Okay, so we will go ahead and move on. And again, if there's any questions at the end, please just go ahead and type them and we can ask at the end.